Now what I have done is I have created composited pictures to be able to create a smile line to tell me exactly where we want to remove tissue and where we want to keep the tissue intact. So now we're going to begin the laser sequence. Watch where I'm going to remove more tissue in the premolar area after I sound the tissue to bone to make sure that we can remove the tissue adequately. When sounding, we're getting to 4 millimeters, which allows about 1 millimeter of gingival reduction. Anything more than that can lead to biological width issues. Okay, so we'll be able to remove 1 millimeter of tissue. As one can see, we've got the position of the right side, the patient's right side, stabilized. Now we're going to do the same to the left side. No reason why, in my opinion, that we need to spend 4 hours on preparation of 10 teeth. It is one of those things where I have found over the years that I just get in and I do it. And let me explain that a little bit. There's some key elements with regard to preparation sequence. One is, don't use the same burr twice. It may seem simple, but if any of us from dental school, think back to your days in dental school, and probably many people still do this, is you do what I call the dink factor. You just tend to get a burr, do something with it regard to the tooth, you put it down, you bring up the next burr, and then before you know it, you've gone through all the burrs 6 or 7 times and picked them up and changed them within the chuck probably 30 to 40 times on some cases. Well, I say you start with 1 burr, go till it's completed, then go to your second burr. In my case, I tend to do gross reduction. If I need to break contacts, I will, and I do at some point, probably about 30% of the time I break contacts. But I will break contacts. I will then go in with a large barrel burr and start to remove incisal, create a lingual bevel, facial reduction. Then I move into a long taper coarse burr, and this is really important where we have the 3 planes of reduction we have to remove. We have the gingival plane, the straight plane, and the incisal plane. The incisal plane is usually missed by many doctors because of the fact that I suppose they feel, just based on the feel of the angulation of the burr, that they've done proper reduction. But what ends up happening is they haven't done that incisal reduction, and the ceramist ends up having to build the ceramics or the porcelain out quite a bit. Now I come back, it's very important that when we use the bond, we're going to be using a bonding agent. As I showed you when we were preparing the veneers, I use Excite. These 2 brushes are what are available, and the Benda brush is a better brush for this application versus the spiky kind of micro brushes. Micro brushes tend to elicit some hemorrhaging around the tissue, and so I prefer to use a Benda brush because it does not do that. I definitely put a nice copious amount around each one of the teeth. We're going to start with tooth number 8 and 9, and I just grab them right out. Remember, tooth number 9 has an XL cement, and tooth number 8 has an XL cement, whereas tooth number 9 has the B cement. We'll cure each tooth for approximately 1 minute, moving 10 seconds around. Okay, the last aspect is just cleaning off any excess cement, which is very minimal, using just a blunted tip 16 fluted or 32 fluted carbide burr.
With just a few more minutes of cleanup and under an hour and a half, our patient walks out with a brand new smile.